Patient education is one of the largest components of our practice here at Balanced Physical Therapy and Human Performance Center. What is that? What does it mean? What is it comprised of? Well, most people, when faced with pain, when faced with immobility, when faced with an injury, have all of the emotions that go along with those things. They have depression sometimes. They have frustration. They have short tempers. They have extraordinary fatigue, particularly if they've been in pain for a long time. And oftentimes they're at the end of their rope. And patient education is so important as a cornerstone in our practice that sometimes patients can actually completely heal themselves with just the right amount of patient education. Once we completely understand a patient's impairments, medical history, objective examination findings, we essentially consider all of those components to educate the particular patient on exactly why they might be moving the way that they are, why they can't move the way that they would like to be able to move, and why a specific certain set of therapeutic exercises or stretches or positions might be beneficial and sometimes might even be detrimental to them. And we are committed at each and every single visit in our practice, particularly at the evaluation, to thoroughly educate every single patient on why they might be feeling the way that they're feeling, considering all of those components that I previously mentioned, inclusive of their medical history, their current objective presentation, and symptomatology, or what we call patient presentation. Patient education is so important that we absolutely promise every patient here at Balanced Physical Therapy will leave with a complete and thorough understanding of whatever pathological process they might be in the middle of, whether it be chronic ankle pain, the inability to turn their head to the left side, for example, a headache that just seems to linger, or a strange feeling shooting down their arm when they lie on their right side. Whatever it might be, after a thorough objective exam, a consideration of a particular patient's past medical history, it is absolutely imperative that every single patient be well educated as to why they feel the way they feel. If you know the why, then the how is very easy, and it makes treatment that much more effective, that much more efficient. After all, our goal is not to have patients here for as long as we possibly can. We want them here. We want them effectively evaluated and diagnosed, extraordinarily treated with the highest levels of professionalism and clinical expertise, and we want them on their way and underway, living their lives the way they want to live them as quickly as is safely possible.